Welcome to the David A. Winston Fellowship Health Policy Ball. Each year, friends and colleagues gather to mix, mingle, and support the Winston Fellowship and Scholarship, as well as recognize the remarkable individuals who are this year's Winston Fellows. The David A. Winston Fellows for 2009 to 2010 have outstanding academic credentials and strong community involvement. But most importantly, our fellows embody the energy and commitment of David Winston himself, working towards the public-private partnership necessary for a high-quality, market-oriented healthcare system. We're honored to introduce the current David A. Winston Health Policy Fellows, John Barkett and Devon Trolley.
I was not a political science major in college, and I went to business school, so I never thought I'd be working on Capitol Hill doing this kind of work, but the opportunity has been terrific. If you have an interest in health policy, maybe not in politics necessarily, but even just in health policy, this is also an incredible opportunity because you'll get a chance to view the spectrum from both sides, both the ideological spectrum and the institutional spectrum. By the end of the summer, you're as well informed about what's going on in health policy as anybody else is. So, that's the interview process. It's something I'm happy I went through and something that no one will ever be able to take away from me.
I think the most surprising thing that I've learned, or at least the most surprising thing that I've observed, has been the interaction between policy and politics. And it's sort of an interaction I always knew was there, but it's not something you can really read about. It's kind of something you have to see. I was really surprised at just how many people were so willing to meet with us and their honesty in answering all of our questions, and they just seemed very candid a lot of the time. And I think that really demonstrates the value and the reputation of the fellowship. It's just how many people were willing to support it.
John and Devon join a group of fellow alumni who have made notable contributions to health policy in the United States. Past fellows are found in the offices of senators and congressional representatives, major healthcare associations, advocacy organizations, foundations, and universities, to name a few.
It was the most important year of my life professionally. Wife and my daughter aside, maybe life changing as well. It was life changing.
I think we met with 200 people in 3 months in terms of informational interviews, but they really were the who's who in health policy in Washington, D.C.
The people that you work with, again, on both sides of the aisle throughout the fellowship program will be invaluable to you throughout your career, and a person that you might disagree with on one day is going to be someone who you work with on another issue in months following.
I think this fellowship is really unique in being able to provide that opportunity and really tailoring it to the unique needs of each fellow.
I think it's incredibly important to attract the best and the brightest graduates from the great health policy programs around the country to come to Washington and be a part of the solution to health care.
Moreover, the fellowship gives you the opportunity for intellectual exploration that you really don't have outside the context of the fellowship.
There's no doubt in my mind that without the fellowship, I would not be where I am today, and I would not be pursuing the career of my dreams. And the Winston Fellowship is the reason that I wake up in the morning and I like what I do. Some days are better than others, but it was the most amazing opportunity that solidified my career in health policy.
It's looking back at it and who you have access to, the people's time that you have, the professionals. These are really busy people that are really active in the field, that have day-to-day schedules that are completely unpredictable, and for them to be able to squeeze in an hour of their time, it's an incredible experience.
I'm so happy with the contacts I've made and just the amount that I've learned. It's really undescribable and really unbelievable. It's a great opportunity, and whoever gets to become a fellow is very, very fortunate.
The fellowship is a tribute to the legacy of David Winston, a true leader with a passion for bringing people together. For 20 years, David played a significant role in shaping American health policy. From his work in his home state of California to his service in Washington, David proved himself uniquely skilled at bridging the gap between the public and private sector.
A networker before we had Facebook or MySpace or Twitter. He was the ultimate networker. He knew everybody, and he worked hard to maintain those relationships.
And he put people before policy. And that combination really made him, that was a foundation of his management style, of his way to accomplish things. It worked very well.
The fellowship was founded in 1988 following David's untimely death. It continues to be an unparalleled opportunity for bright young leaders to come to Washington and make a difference.
David had a special appreciation for younger people entering the healthcare policy field and the contributions that they could offer and their energy and enthusiasm. And so he always went out of his way to meet with fellows.
The fellowship has been something that's been reflective of David as his career involved so much of his ability to help people to communicate among themselves between groups who never had communicated really before, to really then pull together information, synthesize it, and then produce something that was hopefully helpful for the progress of healthcare in our country, but just for the country in general.
None of this would be possible without the support of our sponsors. Heartfelt thanks to everyone who has sponsored tonight's event and to all of those in attendance. Ladies and gentlemen, enjoy your evening.